COPE or COVID-19 Patient Evaluation is an advanced tool built to allow people to self-assess their symptoms and seek guidance when to get medical attention. It combines the potential of various technologies like RPA, chatbot, Firebase database, Amazon EC2 instances, etc. to empower the users to cope with this pandemic. Coronavirus disease, COVID-19, is an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people, and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. CDC Centers for Disease Control and Prevention, and WHO have urged all countries to test more people to curb the pandemic and have issued guidelines for who should be tested, but decisions about testing are made by state and local health departments or healthcare providers. Although the supplies of COVID-19 tests are increasing worldwide, it may still be difficult to test everyone. Thus, there is a need to develop a mechanism to shortlist the potential candidates of COVID-19 to ensure optimum testing and prevent any unnecessary disease spread while testing. Our tool, COPE, integrates with WhatsApp, which is one of the leading social networking platforms with an estimated reach of around 2 billion people worldwide, to provide a one-step solution to empower people to perform COVID-19 self-assessment tests on their own and book their appointments with nearby doctors if necessary. User interacts with the chatbot COPE on WhatsApp, where the user is supposed to provide some basic details and answer some health-related questions. Based on the responses, the chatbot is smart enough to analyze whether the user needs medical attention or not. These responses are stored at Firebase database, from which our Automation Anywhere bot picks data and takes actions accordingly. In case the user needs to book an appointment with a nearby doctor, our Automation Anywhere bot is able to fetch that information from a central doctor's database and provide it in the same chat window. The user can then decide if he or she needs to book an appointment or not. We have used advanced features in Automation Anywhere like API calling and database commands. RPA helps in orchestrating the overall doctor's appointment process and passes the relevant details to the chatbot via Firebase database. Let's take a look at a quick working demo. The user interacts with COPE chatbot and enters the personal details as requested. Scenario 1. The user has mild COVID-19 symptoms. COPE starts the assessment by asking questions about some common COVID-19 symptoms. Based on the user's responses, COPE is able to assess that the user needs to visit a doctor within the next 12 hours. With this, COPE asks if the user needs to book an appointment or not. Based on the user's response, COPE updates the patient database and fetches the doctor details with the help of backend Automation Anywhere bot. The bot searches for the available doctors in a central database, fetches the relevant appointment details and passes to the chatbot via Firebase database. The appointment details are shown to the user. The user selects the preferred time slot and COPE books the appointment accordingly in the backend. COPE shares the appointment details with the user along with some other relevant information. Scenario 2. The user doesn't have any COVID-19 symptoms. COPE starts the assessment by asking questions about some common COVID-19 symptoms. Based on the user's responses, COPE is able to assess that the user doesn't need medical attention. COPE shares some preventive measures with the user to be kept in mind during the pandemic. Scenario 3, the user has severe COVID-19 symptoms and needs immediate medical attention. COPE starts the assessment by asking questions about some common COVID-19 symptoms. Based on the user's responses,